Welcome back, everyone. We are moving into our next session, which is the Badger Care Plus eligibility rules. So if you could please have your PDF of forming a Badger Care Plus Magi group for this presentation, that will be really helpful as you learn about this. I will go ahead and hand it back over to Nikki and Maciel.
All right. Thanks, Elizabeth. Just making sure people can hear me before I start talking a mile a minute, or not a mile a minute. I'll try and go slow. All right, great. Welcome back, everybody, to session 2, Badger Care Plus eligibility rules. Just like with our first session, questions can be entered in the Q&A box, and we'll address them at the end of the session as long as we have time. Again, Maciel's with me to assist with questions. And if there's any that we can't get to, or we don't have time for, or we don't know the answer to, we'll follow up with those later. So let's go ahead and get started. Today's agenda includes the purpose of this training, an overview of Badger Care Plus, including the non-financial and financial rules and resources. The purpose of this training is to provide navigators, certified application counselors, partners, agents, and brokers with an overview of the eligibility rules for Badger Care Plus. As a reminder, session 1 this morning was applying for Wisconsin's healthcare programs, and tomorrow's 8:30 session will focus on eligibility rules for elderly, blind, or disabled Medicaid. Before we dive into today's training, you should have received that PDF handout titled Forming a Badger Care Plus Magi Group. The PDF is also posted on the conference website, I believe. You will need that handout when we get to some examples of how to determine a Badger Care Plus Magi Group household size. So if you weren't able to print that handout before, I would encourage you to go ahead and either print it out quick now, or if you have an additional screen, you could view it on your second screen when we get to that part of the session. So let's take a look at an overview of Badger Care Plus eligibility rules. Before we do, please keep in mind that this training provides an overview of the eligibility factors that will be considered for Badger Care Plus. It's not intended as a training on how to determine eligibility. Only income maintenance or IM agencies can determine eligibility for most programs. The policies described in this training are subject to change, and updates are available at the links shown on this slide. The first slide would take you to a page that provides links to different healthcare program information. And then the second link will take you to a page where you can sign up to receive email updates regarding DHS programs and services. Badger Care Plus covers children ages 0 through 18, parents and caretaker relatives of children ages 0 through 18, pregnant people, and childless adults ages 19 through 64 who are not receiving Medicare, except for Medicare Part B immunosuppressive drug benefit, also called Part B ID. Badger Care Plus is a state and federal program that provides health coverage for low-income Wisconsin residents. Badger Care Plus is funded by Medicaid, Title 19, and the Children's Health Insurance Program, also called CHIP or Title 21. Most of the Badger Care Plus populations are funded by Medicaid, but some higher income children and the prenatal program are funded by CHIP. CHIP is primarily a program covering low-income children's healthcare needs. CHIP also, again, covers pregnant people who are enrolled in the Badger Care Plus prenatal program. Let's take a look at the non-financial rules for Badger Care. Individuals must fall into one of these groups to qualify for Badger Care Plus. And we've talked about these before: a child age 0 through 18 years old, a parent or caretaker relative who lives with and cares for a child age 0 through 18 years old, and there's no age limit for the parent or caretaker relative that's caring for the child, a pregnant person, again, no age limit, or a childless adult. And a childless adult is a person ages 19 to 64 years old who is not receiving Medicare except Medicare Part B ID, and who does not have any dependent children younger than 19 years old who reside with them at least 40% of the time. Marital status has no effect on a person being a childless adult. As I mentioned earlier, the healthcare benefits for some children with higher household incomes are funded through the Children's Health Insurance Program, also known as CHIP. This includes children ages 1 to 5 with income above 191% of the federal poverty level, or FPL, and children ages 6 to 18 with income above 156% of the FPL. As a result, these children are subject to different rules regarding backdated coverage and crowd out policies. Additionally, to qualify for Badger Care Plus, individuals must be a Wisconsin resident, physically present with an intent to reside in Wisconsin, be a U.S. citizen or qualifying immigrant, provide their Social Security number with some exceptions, and supply required information and verification within the required time frame. Finally, they must meet crowd out rules when they apply. Children with higher incomes may not qualify if they have access to or coverage through certain employer sponsored health insurance. And some pregnant people who are immigrants or incarcerated in a correctional facility, such as a jail or prison, may not qualify if they have other health insurance or have access to employer sponsored health insurance. And we're going to start this out with a poll question already. I'm going to keep your attention here. Question 1, what population does not qualify for Badger Care Plus? A, pregnant people. B, a child under age 19. C, parents and caretaker relatives living with children under age 19. D, childless adults ages 19 through 64. Or E, people ages 19 through 64 who are receiving Medicare other than Part BID. What population does not qualify for Badger Care Plus? I'm going to give you a couple minutes here. Probably not a couple minutes, more like 30 seconds. Okay. All right. Great job. The correct answer is E. People ages 19 through 64 who are receiving Medicare other than Part BID do not qualify for Badger Care Plus. All right, let's talk about the financial rules for Badger Care Plus. Financial eligibility is based on the household's expected monthly income. In some circumstances, annual income may also be considered. Assets are not considered when determining eligibility for Badger Care Plus. Let's talk about those income limits. The federal poverty level, or FPL, is a federally determined income amount that's scaled based on household size and is usually adjusted every year. The FPL amounts seen here were effective February 1st, 2024, and can be found at the link shown on this slide. The income limit for adults is at or below 100% of the FPL for the appropriate household size. For children and pregnant people, the income limit is at or below 306% of the FPL for the appropriate household size. People whose income is too high to be eligible for Badger Care Plus may be eligible for advanced premium tax credits, or APTCs, through the marketplace. APTCs can help lower monthly insurance payments when enrolling in a health insurance plan through the marketplace. The American Rescue Plan Act expanded eligibility for APTCs beyond the original 400% FPL, and the Inflation Reduction Act extended this provision through 2025. Since this session is specifically about Badger Care Plus, we won't be going into details about APTCs and health insurance through the marketplace, but we did want to mention those expanded eligibilities for APTCs. Modified adjusted gross income, also known as MAGI rules, are used to determine household size and household income for Badger Care Plus. MAGI rules are also used when determining eligibility for advanced premium tax credits or APTCs at the marketplace. Using MAGI rules, IM agencies determine how big the household is, also known as household size, which household member's income is going to be counted, and what types of income and deductions are counted. And that brings us to our second poll question. The income limit for Badger Care Plus for pregnant people is what percent of the FPL? A, 100%, B, 150%, C, 200%, D, 256%, or E, 306%. Again, the income limit for Badger Care Plus for pregnant people is what percent of the FPL? I'll give you a little bit to answer that. All right, great job. It looks like the majority of you did answer correctly. The correct answer is E. The income limit for Badger Care Plus for pregnant people is 306% of the FPL. All right, so let's move on to how the household size is determined for MAGI rules, which honestly can be a little complex. In some cases, the household size is based on who plans to file taxes and whom they plan to claim as tax dependents. These are called tax rules. In other cases, household size is based only on how the household members are related to each other, and these are called relationship rules. Now, as a result of these rules, different household members can have different household sizes. Additionally, for any pregnant people included in a given household, the household size is increased by the number of babies expected. Verification of pregnancy is not required unless the IM agency has information that contradicts the person's statement. At this time, we're going to be walking through some examples of how to determine a Badger Care Plus MAGI group's household size. So this is when you'll need to pull out either that printed version of the Forming a Badger Care Plus MAGI group PDF that we talked about earlier, or go ahead and bring it up on a separate screen, because that PDF is going to walk us through the logic flow to help us determine the correct household size. All right. In most cases, if an adult in the household is planning to file taxes and is not being claimed as a tax dependent by anyone else, the household includes the tax filer, the tax filer's spouse, and tax dependents. So let's take a look at our first example. Joe and Liz are married and have two young sons, Matt and Leo. Liz is pregnant. Joe and Liz plan to file taxes jointly and claim both children as tax dependents. So using our handout, let's use Joe as the target. Starting at the top of that handout, first, we ask ourselves, is Joe planning to file taxes? And he is. So then we ask if he will be claimed by anyone else as a tax dependent. And he will not be. So the answer is no. Which brings us to the next block, which is, if no, include the target, which is Joe, the target spouse, which is Liz, and all of the target's tax dependents, which is both children, Matt and Leo. So we're currently at a household size of 4. But then it says if there's a pregnant person in the group, include the number of expected babies and count only one baby if the number of expected babies is unknown. So we know Liz is pregnant and we're going to assume she's only pregnant with one baby. So Joe's household size is 5. Joe, Liz, the expected baby, Matt, and Leo. Liz's household size would also be 5 if we use her as the target. And if we look at one of the children as the target, we get the same result. Let's use Matt and start back at the top of our flow. Is Matt expecting to file taxes? No, he's a child and he doesn't have a job or any income. So then we see if no, go to step 3. Step 3 asks, is anyone else claiming the target as a tax dependent? And the answer to that is yes, right? Joe and Liz are filing taxes, claiming both children as tax dependents. So if yes, then is the target living in one household with both parents who are not filing taxes jointly? And we just discussed that, right? The answer is no, because the parents are filing taxes jointly. Then, if no, will the target be claimed by a parent living outside of this household? And again, that answer is no. And if no, then the target's Magi household group will be the same as their tax filers group. Max's tax filer is Joe and Liz since they are filing jointly and claiming both children. And Joe and Liz's household group we said was 5. So Matt's group, as well as Leo's, will be 5, the same as their tax filer. Now, I do just want to mention that the CARES Worker Web System, or CWW, does determine these groups automatically for the IM worker, but it's based on the information communicated in the application, which is why it's so important that those household relationships are identified correctly when submitting the application. Moving on to example 2, we have Rich. Rich is a single adult who lives with and provides financial support to his elderly mother, Maggie. He plans to claim Maggie as a tax dependent. We're going to let you practice on this one, so I'm going to give you a bit to look at your handout and see if you can identify Rich's household size on your own, and then I'll give you the answer and we will walk through it together. So go ahead and take a little bit to walk through the handout and just jot down or keep in your mind what you think the answer will be for Rich's household size. I feel like I should have some Jeopardy music here. You don't want me to sing it, trust me. All right. Let's take a look at the answer for this one. Rich's household size is 2. Rich and his mother Maggie, since he plans to claim her as a tax dependent. And let's walk through this one together. First, we ask ourselves, is Rich planning to file taxes? And he is. So then we ask if he will be claimed by anyone else as a tax dependent. And he will not be. So the answer is no, which brings us to the next block, which is if no, include the target, which is Rich, the target spouse, and he doesn't have one, and all of the target's tax dependents, which is Maggie, right? So Rich's household size is 2, Rich and his mother Maggie. Now let's talk about relationship rules. In most cases, if an adult in the household is not planning to file taxes, the household includes the adult, their spouse, and their children under age 19 who are living with them. So let's take a look at example 3 together. Mike and Kelly are married and have a young daughter, Fiona. Mike and Kelly do not plan to file taxes. So using our handout, let's use Mike as the target. First, we ask ourselves if Mike is planning to file taxes, and he is not. So we see that if no, go to step 3 and ask, is anyone else claiming Mike as a tax dependent? And the answer again is no. Nobody else is claiming Mike as a tax dependent. And we see if no, go to step 4, which is to use relationship rules, which tells us if they are living in the home, include the target spouse and their children under age 19. And then it goes on to speak about if the target is under age 19. So let's stop there for now because Mike's over age 19. So that means Mike's household size is 3. Mike, his spouse, Kelly, and his daughter under age 19, Fiona. And Kelly's household size would be the same. Let's take a look at Fiona's household size. Starting again from the top of that handout, Fiona is not expecting to file taxes. So we go to step 3. Nobody else is claiming her as a tax dependent. So that takes us to step 4, which again is relationship rules. So we'll count the target's spouse and their children under age 19. Fiona's a child, so she doesn't have a spouse or children. Moving on, though, we see that if the target is under age 19, which Fiona is, then we'll include her parents and siblings under age 19 if they're living in the same household. And both of Fiona's parents are in the household. She doesn't have any siblings, so her household size will also be 3. All right, let's move on to example 4. Lars and Laura are childless adults who live together but are not married. Laura is pregnant, and neither of them is filing taxes. I'm going to give you a bit to look at your handout and see if you can identify both Lars and Laura's household sizes. And then we will give you the answer and we'll walk through it together. But go ahead and take a couple moments, jot down what you think the answer will be. What is Lars's household size and what is Laura's household size? Should have like a little stopwatch or something at least on the screen. All right, let's go ahead and take a look at the answers and walk through them, starting at the top of the handout for each one of them. Lars's household size is 1. So for Lars, first, is Lars expecting to file taxes? No. Is anyone claiming him as a tax dependent? No. And he doesn't have a spouse or any children under age 19 in the household, so his household size is 1. Laura's household size is 2. Is starting at the top of the handout, is Laura expecting to file taxes? No. Is anyone claiming her as a tax dependent? No. Does she have a spouse or any children under age 19 in the household? No. Is she pregnant? Yes. So we add her expected baby to her household size, and her household size is 2. Now, relationship rules are also used for children who are claimed as a tax dependent by someone other than their parent, children who are claimed as a tax dependent by a parent who lives outside of the home, and children who live with both parents, but those parents are not filing jointly. When relationship rules are used for children under age 19, their household includes parents who are living with them and siblings under age 19 who are living with them. And we've already seen this when looking at the other household members in our prior scenarios, but let's take a look at a few more. Example 5. Jaden, Rylan, and Warren are teenage brothers, all under age 19, who live with their Aunt Sarah. Sarah plans to file taxes and claim all 3 brothers as tax dependents this year. So let's walk through the first one together. First, with Sarah as the target, starting from the top of our handout. Is Sarah expected to file taxes? Yes. So we know we'll be using tax filing rules. Will Sarah be claimed by anyone else as a tax dependent? No. So we'll include Sarah, her spouse, and she doesn't have one, and all of her tax dependents, which would be all 3 nephews. So Sarah's household size is 4. Now let's use any one of the brothers as the target, starting from the top of our handout. Is he expecting to file taxes? No. So we'll go to step 3. Is anyone else claiming him as a tax dependent? Yes. Is the tax filer his parent or spouse? No, it's his aunt. So we'll go to step 4, which is relationship rules, and include, if they're living in the home, the brother's spouse and children. And of course, all of them are children, and so none of them have a spouse or children of their own. And if under the age of 19, which he is, we'll also include the child's parents, and neither of the parents are in the home, and his siblings under age 19, and he has 2 siblings under age 19 in the home. So each brother has a household size of 3. All right, let's move on to example 6. We have Jocelyn. Jocelyn is divorced and lives with her 17-year-old daughter, Macy. Jocelyn plans to file taxes, but Macy's father, Chris, plans to claim Macy as a tax dependent this year. I'm going to give you a bit to look at your handout and see if you can identify both Jocelyn and Macy's household sizes. And then I'll give you the answers and we'll walk through them. So go ahead and take a couple minutes to walk through each of those, Jocelyn and Macy, to see what their household sizes are. And then we'll go through them together. Okay, let's take a look at the answers. Using tax rules, Jocelyn's household size is 1 because she's a tax filer with no dependents. Starting at the top of our handout, is Jocelyn expected to file taxes? Yes. Will she be claimed by anyone else as a tax dependent? No. So tax filing rules are used and will include Jocelyn, her spouse, if living in the home and filing jointly, and she doesn't have a spouse, and all of her tax dependents, and she doesn't have any. So her household size is 1. Because Chris is a parent who lives outside of the household and is claiming Macy, relationship rules are used for Macy. Macy's household size is 2, herself and her mother. Starting at the top of the handout, is Macy expecting to file taxes? No. So we go to step 3. Is anyone else claiming her as a tax dependent? Yes. Is the tax filer her parent or spouse? Yes. Does she live in the household with both parents who are not filing taxes jointly? No, both parents don't live in the home. So, will she be claimed by a parent living outside of this household? Yes. So we go to step 4, which is relationship rules, and we include, if they are living in the home, her spouse and children under 19, and she doesn't have a spouse or children. Since Macy is under age 19, we include her parents and siblings under age 19 if they are living in the same household. So since Macy's mother, Jocelyn, is living in the household, she's added to her household size, and Macy's household size is 2. All right, here's our last example. Example 7. Dan and Jackie live together but are not married. They have 10-year-old twins, Sadie and Lily. Dan plans to file taxes and claim both of the kids as his dependents. Jackie also plans to file taxes. I'm going to give you a bit to look at your handout, see if you can identify Dan's household size, Jackie's household size, and the children's household size. So go ahead and take a few minutes to jot down your answers, and then we'll look at the answers together. All right. How are we feeling about this one? Let's go ahead and take a look at the answers. Using tax rules, Dan's household size is 3 because he's a tax filer with 2 tax dependents. Starting at the top of your handout, is Dan filing taxes? Yes. Is he being claimed by anyone else as a tax dependent? No. So tax filing rules are used, and we include Dan, his spouse, if living in the home or filing jointly, and he's not married, and all of his tax dependents, and he's claiming both children. So his household size is 3. Using tax rules, Jackie's household size is 1 because she's a tax filer with no dependents. Starting at the top of our handout, is Jackie filing taxes? Yes. Is she being claimed by anyone else as a tax dependent? No. So tax filing rules are used, and we include Jackie, her spouse if living in the home or filing jointly, and she's not married, and all of her tax dependents, and she doesn't have any. So her household size is 1. For the twins, relationship rules are used because their parents are living together but not filing jointly. Each child's household size is 4 because it includes the child, her sister, and their 2 parents. Starting at the top of our handout, is the child filing taxes? No. Is the child being claimed by anyone else as a tax dependent? Yes. So we go to step 3. Is anyone else claiming them as a tax dependent? Yes. Is the tax filer the target's parent or spouse? Yes. The tax filer is the children's father, Dan. So do they live in one household with both parents who are not filing taxes jointly? Yes. So we go to step 4, which is relationship rules, and we include if they're living in the home, their spouse and children under 19. The children aren't married and don't have any children of their own. They're both under age 19, though, so we do include their parents and siblings if they're living in the same household. So since they are siblings and both parents live in the household, each child has a household size of 4. All right, to wrap up our conversation about household size, here are just a few additional notes. Tax dependents can be included in someone's household size even if they're living outside of the home or are deceased. Tax filers can claim a deceased child as a tax dependent or a deceased spouse as a tax co-filer in the year they pass, and they would be included in the tax filer's group size. Always be included unless they're living separately and filing taxes separately. To be considered to be living with a parent, a child under age 19 must be in the parent's home at least 40% of the time. If parents are divorced, only one parent can claim the child as a tax dependent each year. And tax rules are based on how the person plans to file taxes for the current tax year. More information about households can be found in Badger Care Plus Eligibility Handbook, Chapter 2.3, and the link to that handbook is shown on this slide. The flowchart we provided as a handout today could also be found in the handbook in Chapter 2.3.3. All right, time for our next poll question. Question 3. Relationship rules are not used for the indicated individual in which scenario? So this one's a little complicated. Here's a hint. Households may have some people under tax rules and other people under relationship rules. So when we're providing these options, only think about tax rules or relationship rules if they're used for the specific individual described in each scenario. So again, the question is, relationship rules are not used for the indicated individual in which scenario? In other words, which one of these will use tax rules instead of relationship rules? Is it A, an adult in the household who is planning to file taxes and is not being claimed as a tax dependent? B, an adult in the household who is not planning to file taxes? C, a child who is claimed as a tax dependent by a parent who lives outside of the home? Or D, a child who lives with both parents, but those parents are not filing jointly? Again, relationship rules are not used for which of these indicated individuals? We'll give you some time to answer that. So another way to look at this is which of these individuals will use tax rules instead of relationship rules? This one's a little harder. We're seeing that in the answers. Okay. The correct answer is A, an adult in the household who is planning to file taxes and is not being claimed as a tax dependent. So when an adult in the household is planning to file taxes and is not being claimed as a tax dependent, tax rules will be used to determine their household size, not relationship rules. All other individuals described would use relationship rules. Next, let's talk about income. First, let's talk about whose income is counted. In general, all household members' income is counted. However, if a household member is a child or tax dependent of another household member, their income is only counted if they're expected to be required to file a tax return for the current year themselves. Expected to be required includes children or tax dependents who expect to have more than $14,600 in earned income or more than $1,300 in other income for the tax year. And you may want to jot those facts down for our example. So, children that are expected to be required are those who expect to have more than $14,600 in earned income or more than $1,300 in other income for the tax year. For this expected to be required rule for children or tax dependents, other income does not include child support, Social Security, supplemental security income, also known as SSI, workers' compensation, veterans benefits, money from another person, or educational aid. So if the child or tax dependent is receiving these types of income, they're not counted when we're determining if the person meets the thresholds and is expected to be required to file a tax return. Doesn't necessarily mean that the income won't be counted when we're determining eligibility, and we'll talk about what type of income is counted when determining eligibility in a bit. These thresholds are updated annually, and these thresholds on this page were effective January 1st, 2024. So let's talk about this in the context of an example. And we're going to go back to example 6, which was Jocelyn is divorced and lives with her 17-year-old daughter, Macy. Jocelyn plans to file taxes, but Macy's father, Chris, who doesn't live in the home, plans to claim Macy as a tax dependent this year. Using tax rules, Jocelyn's household size was 1 because she was a tax filer with no tax dependents. And because Chris was a parent who lived outside of the household and was claiming Macy, relationship rules are used for Macy. Macy's household size is 2, herself and her mother. Now, Macy has a part-time job at McDonald's, and she's earning approximately $400 a month. And I'm going to encourage you to jot down these facts as well. Jocelyn's household size is 1, just herself. Macy's household size is 2, herself and Jocelyn. And Macy has earned income of $400 a month. So for Jocelyn's eligibility, since we'll use tax filing rules for her, her household size is 1 and only her income is counted for eligibility. And Macy's eligibility, since we'll use relationship rules, her household size is 2, so her mother's income will be counted. However, since Macy is the child of another household member, her income is only counted in her eligibility determination if she's expected to be required to file taxes. So let's take a look at that. Remember, Macy's only income is from her job and she only earns approximately $400 a month. So she expects to earn approximately $4,800 this year from her job and is below the expected to be required to file threshold, which we said was currently $14,600 in earned income per year. So her income is not counted in her eligibility determination. And I want to mention that it's not counted even if she chooses to file taxes. The fact that she's not expected to be required to file supersedes whether or not she chooses to file. Therefore, only Jocelyn's income will be counted for Macy's eligibility. Now, if Macy were to earn $1,400 a month from her job or $16,800 a year, she would be above the threshold of $14,600, and her income would be counted for her eligibility in addition to Jocelyn's income. But it still wouldn't count for Jocelyn because Jocelyn's a household size of one, just herself. Now that we know whose income is counted, let's move on to what income is counted. Most taxable income is counted for Badger Care Plus. This includes, but is not limited to, taxable gross earnings from a job, taxable earnings from self-employment, unemployment compensation, student financial aid if used for living expenses, taxable retirement, pension, and annuities, and interest and dividend income. I want to point out that Social Security income is usually not taxable, but it is counted for Badger Care Plus, unless it's income of a child or tax dependent under the income limit for that expected to be required rule. Next, let's take a look at what income is not counted. Examples of common types of income that are not counted for Badger Care Plus eligibility include child support, alimony, spousal support, or maintenance payments if they were received under a separation or divorce agreements completed after January 1st, 2019, supplemental security income, also known as SSI, gifts or money from another person, workers' compensation, and veterans benefits. A full list of income that's not counted is available in Badger Care Plus Eligibility Handbook, Chapter 16.2. Next, let's talk about deductions. A deduction is amount that can be subtracted from the amount of income used to determine eligibility. Pre-tax paycheck deductions are allowed as Badger Care Plus income deductions. An example of this might be a pre-tax contribution to a health savings account. Tax deductions listed on IRS Schedule 1, Form 1040, are also allowed. Examples include student loan interest paid and self-employment tax. Itemized deductions like mortgage interest and charitable contributions are not allowed. A full list of income deductions can be found in Badger Care Plus Handbook, Chapter 16.3. And that brings us to our next poll question. Question 4, what type of income is not counted for Badger Care Plus? Is it A, Social Security payments, B, child support payments, C, taxable earnings from self-employment, D, unemployment compensation, or E, taxable gross earnings from a job? And you'll go ahead and answer that in the live poll section. So if you want to go ahead and scroll over to the live poll section to answer that question. What type of income is not counted for Badger Care Plus? All right, great job. The answer is B. Child support payments are not counted as income when determining Badger Care Plus eligibility. Now, let's talk about some special situations, which include 12-month continuous coverage, healthcare coverage for children, continuous eligibility for pregnant people, continuous eligibility for newborns, presumptive eligibility, also known as express enrollment, gap filling, former foster care youth, income extensions, Badger Care Plus emergency services, Badger Care Plus prenatal program, family planning only services, and premiums. The Consolidated Appropriations Act 2023 mandated that members who are under age 19 will keep their coverage until it has been 12 months since their last application or renewal, with some limited exceptions. Prior to this act, if a family had a change in income or other circumstances, children in the household could lose coverage because of that change. Effective January 1st, 2024, children will stay enrolled at least until their next renewal, again with some limited exceptions. The 12-month continuous coverage period for children starts with the month of application, the new certification period at renewal, or when the child otherwise becomes eligible under a qualifying Badger Care Plus group. Backdated months at application and renewal do not count toward the 12-month continuous coverage period. A child only eligible for one or more backdated months, but not the month of application or ongoing, does not qualify for a 12-month continuous coverage period. Children under age 19 in the programs shown on this slide are eligible for 12 months of continuous coverage. Continuous coverage does not apply to children who are enrolled under presumptive eligibility, also known as express enrollment, or children required to meet a deductible to enroll in Badger Care Plus or Medicaid. A child could lose coverage during the 12-month period if they turn 19, if they move out of Wisconsin, if their citizenship or immigration status is not verified, or if the family asks to end their coverage. There are a couple of other circumstances in which members are considered to have continuous eligibility. They include pregnant people who become eligible for Badger Care Plus. These pregnant people stay eligible through the end of their pregnancy, and they are also eligible during a postpartum period that lasts until the end of the month in which the 60th day after the end of the pregnancy occurs. And babies who are born to a mother enrolled in Badger Care Plus or Medicaid. So mom must have been receiving Badger Care Plus or Medicaid at the time of the child's birth for this continuous eligibility to apply to the baby. These babies stay eligible for Badger Care Plus until they turn 13 months old. These eligibility periods for pregnant people and newborns continue even if the household's income goes over the program's income limit. Presumptive eligibility, often abbreviated as PE, is also known as express enrollment, often abbreviated as EE, or temporary enrollment, often abbreviated as TE. Honestly, we're not trying to confuse anyone. It's just that sometimes different partners call programs by a different name, and we want to make sure that you know that whether you hear it called PE, EE, or TE, they're all talking about the same program that provides this express temporary enrollment based on the presumption of eligibility established from household and financial information provided by the applicant to the partner, provider, or qualified hospital. So, presumptive eligibility is a streamlined online application for Badger Care Plus or family planning only services that's facilitated through partners, providers, and/or qualified hospitals. I also want to mention that presumptive eligibility is not the same as presumptive disability. We'll talk about presumptive disability briefly in the session on EBD Medicaid eligibility rules tomorrow. So let's talk about presumptive eligibility. Presumptive eligibility provides up to 60 days of benefits before the individual must apply for ongoing benefits through the Income Maintenance Agency, and presumptive eligibility is available to children, pregnant people, parents or caretaker relatives of children ages 0 through 18, and childless adults under age 65. More information about non-financial rules and income limits for presumptive eligibility can be found in the Badger Care Plus Handbook in Chapter 32. As a reminder, 12-month continuous coverage does not apply to children enrolled in presumptive eligibility. Next, we have information on gap filling. In most cases, eligibility for Badger Care Plus is based on monthly income. At the marketplace, eligibility for advanced premium tax credits, or APTCs, is based on expected annual income. Only people with household income above 100% of the FPL are eligible for APTCs. So someone can be ineligible for Badger Care Plus because of their high monthly income and ineligible for APTCs as well because of low annual income. Here's an example. James is unemployed for most of 2023 or 2024, but starts a job in October earning $3,000 a month. As a single adult, he's well above the monthly income limit of $1,255 for Badger Care Plus, but his annual income is only $9,000, which is below 100% of the FPL for the year, which would make him ineligible for APTCs. In situations like these, individuals can enroll in Badger Care Plus based on their annual income. This type of enrollment is called gap filling. Applicants and members found eligible under gap filling rules are certified under a 12-month eligibility period like other Badger Care Plus members. This rolling 12-month certification period can start and end any month of the year. It allows members to keep their certification period even if they change from having their eligibility determined under monthly income rules to annual income rules when they report changes. Because 12-month certification periods often extend over 2 calendar years, the applicant or member's expected annual income will be collected at the beginning of a new year. By expected annual income, we mean the amount of income the person thinks they'll receive in the new calendar year. Since people haven't actually received that income yet, they may just need to give us their best estimate. Verification of next year's expected annual income is not required, since again, they likely won't have any proof of income they haven't received yet. There are some situations where a person applies at the marketplace and is told their annual income is too low for APTCs, but when their eligibility is determined for Badger Care Plus, their annual income is too high to be eligible for Badger Care Plus under gap filling rules. In most cases, this is because they didn't report all of their income when applying at the marketplace. Someone denied Badger Care Plus under gap filling rules can provide updated income information to the marketplace or appeal their marketplace decision. Moving on to former foster care youth. Former foster care youths include anyone who is in foster care, subsidized guardianship, or court-ordered and kinship care when they turned 18. For this population, no income limit is applied when determining their Badger Care Plus eligibility until they turn 26. Keep in mind that their income information may still be needed if they're included in another household member's assistance group, though. Next, let's talk about earned income extensions. When a parent or caretaker relative's earned monthly income goes above 100% of the FPL due to increased earnings, their eligibility and their children's eligibility is extended by 12 months. The parent or caretaker relative must have been enrolled in Badger Care Plus with a monthly income at or below 100% of the FPL for at least 3 of the last 6 months prior to the income increase in order to be able to enter the extension. The extension continues as long as the household continues to meet the basic non-financial rules and there's no income limit during the extension. However, if the household's verified income goes below 100% of the FPL during the extension, the household will go back to normal Badger Care Plus. They'll no longer be in the extension. This is also known as transitional medical assistance. Now, there are other reasons outside of income considerations when someone's eligibility may be extended. Moving on to Badger Care Plus emergency services, this is a limited benefit Badger Care Plus program that covers services needed for the treatment of an emergency medical condition when certain individuals meet all Badger Care Plus program rules except for citizenship or qualifying immigration status and having or applying for a SSN. Children enrolled in emergency services qualify for 12 months of continuous coverage. Badger Care Plus emergency services is not available for childless adults, which are adults ages 19 through 64 who are not living with and caring for a child under age 19. It's not available for children with higher incomes or for members enrolled in Badger Care Plus prenatal program, which we'll be talking about next. While emergency services applications are processed by IM agencies, it's not the responsibility of the IM agency to determine if the applicant's condition is or was an emergency condition and reimbursable under Badger Care Plus emergency services. It is the IM agency's responsibility to manually determine if the non-qualifying immigrant meets all eligibility requirements during the dates of service and certify them if they're eligible for emergency services. Medical providers who have treated a non-qualifying immigrant for emergency services may complete the certification of emergency for non-U.S. citizenship, Form F01162, to verify that the services provided were to treat an emergency medical condition, and the patient can provide that to the IM agency when applying for assistance, although the form is not required. Additionally, a provider's certification of emergency by completing that Form F01162 does not guarantee reimbursement. When the medical provider submits claims for emergency medical services to the fiscal agent determines if a condition is an emergency medical condition covered by emergency services. More information about emergency services can be found at the link shown on this slide. Badger Care Plus prenatal eligibility is different than regular Badger Care Plus for pregnant people, which we discussed earlier. Badger Care Plus prenatal is available to pregnant people who meet all other rules for Badger Care Plus, but do not qualify because they don't have citizenship or qualifying immigration status, or are incarcerated in a correctional facility such as a jail or prison. People are not eligible for Badger Care Plus prenatal if they're currently covered by any HIPAA health insurance policy. They may not have current or past access to an employer-sponsored health insurance plan in which the employer pays at least 80% of the premium. People enrolled in Badger Care Plus prenatal do not qualify for backdated eligibility, and continuous eligibility for pregnant people does not apply to people enrolled in Badger Care Plus prenatal. Family planning only services are a limited benefit plan for people of childbearing or reproductive age. It covers certain services and supplies related to family planning. The income limit for family planning only services is 306% of the FPL. The household size is always 1, and only the individual's own income is counted. Finally, let's talk about children's Badger Care Plus premiums. Children with household income above 201% of the FPL will be charged premiums except for pregnant minors, former foster care youth, children already in their 12-month continuous eligibility period, children who have met a Badger Care Plus deductible won't have premiums during the remainder of the deductible period, children in a Badger Care Plus extension, all children under age 1, including continuous eligible newborns, and American Indian or Alaskan Native tribal members, the son or daughter of a tribal member, the grandson or granddaughter of a tribal member, or anyone otherwise eligible to receive Indian health services. Children and families with income over 201% of the FPL will be charged premiums beginning with new applications dated April 1st, 2024. Applications with filing dates prior to April 1st, 2024 will not be charged premiums until after they complete their next scheduled timely renewal. Payment of a premium is not a condition of eligibility for Badger Care Plus, and failure to pay a premium will not result in eligibility ending. Premium payments made will not be refunded unless a change has occurred that reduced or eliminated the premium amount being charged. And that brings us to our last poll question. Question 5. Which of the following is a true statement regarding applicants or members eligible under gap filling rules? A. At the end of the year, members eligible under gap filling rules must reapply for Badger Care Plus. B. The marketplace must send an application to Wisconsin that has been identified as a possible gap filling situation for gap filling rules to be used in the eligibility determination. C. An applicant or member determined eligible under gap filling rules must submit their expected annual income at the beginning of a new calendar year. Or D. Applicants and members found eligible under gap filling rules have a shortened certification period, less than 12 months. Which of those is a true statement regarding applicants or members eligible under gap filling rules? And we're counting down on time here, so I'm going to go ahead and give you the answer. The answer is C. An applicant or member determined eligible under gap filling rules must submit their expected annual income at the beginning of a new calendar year, although verification of the next year's income is not required. To finish up, I just wanted to provide you with some additional resources. Online policy resources such as policy manuals, handbooks, forms, and directories can be found by following the first link on this slide. And the specific link for the Badger Care Plus Eligibility Handbook is also shown here as the second link on this slide. Whew, that does take us to the end of our session. We don't have a lot of time for questions. I'm just going to go to the live Q&A to see. Go ahead.
Nikki, can you hear me? We just have the question from Ileana, I think the name is, was referring to slide 38. I hope that helps. They were looking for additional. It says, can you give me some examples of other types of income for children that would count? I don't know if we have the answer to that. I just wanted to hopefully help you.
Well, if a child was receiving, let's see, these incomes are not counted: child support, SSI, workers' comp, veterans benefits. However, maybe a child is receiving SSDI. That puts them over the expected to be required to file. Then their income would count for them. Or if the child is receiving SSDI, the income may count for their parent as well. So it's really having to look at the income type to see, number one, whose income is included in the eligibility determination, and then when we decide whose income is counted, determining the type of income they have and whether or not it's counted. So it's really hard to say, well, this is an example, because there may be other circumstances along with the example that qualify it to be counted or disqualify it to be counted. It's really taking each income and determining whether it's going to be used and whether it's a type that must be counted or is excluded.
Right. No, I appreciate that.
Qualifying immigration status includes someone who has applied for asylum and has had their application accepted but doesn't yet know the result. I can't answer that question in this session.
We'll be happy to take that back. We're going to work with Cover Wisconsin to provide answers to questions we did not get to. So please know that we will certainly follow up. And I think Elizabeth has an announcement to share.
Yeah.
Yes. So we will be doing a very quick break until 11 o'clock. So at 11, we will be doing a healthcare.gov application walkthrough with Adam Vance Bankeren, who's from Covering Wisconsin. Nikki and Maciel, thank you so much for your presentations today. And we will see Nikki and Maciel tomorrow morning as well. So we will be back at 11 and looking forward to seeing you all again.
Thank you.
Thank you.
Thank you.